Hello everyone, welcome back to the Happy Teeth Club. So in this video we will learn about MELKERSON-Rosenthal syndrome. It is also known as orofacial granulomatosis and cheilitis granulomatosis. So it is a triad of cheilitis granulomatosa, facial palsy and fissured tongue. In this figure we can see cheilitis granulomatosa, that is inflammation of lip, fissured tongue and facial palsy, in which we can see drooping of eyebrow, drooping of eyelids, facial nerve paralysis, drooping corner of the mouth. Now etiology, genetic predisposition, other factors like dietary and contact antigens. Now clinical features. Symptoms appear during early childhood, no gender predilection, upper lip is more prone than lower lip. There is a sudden diffuse nodular swelling which undergo fissured brown scaling and is very painful. Now treatment. Avoid allergens. We can give intralesional steroids, mast cell stabilizer, tetracycline and in severe case radiation surgery. Antibiotics, antihistamine, corticosteroid injections, immunosuppressant, methotrexate, non-steroidal anti-inflammatory drugs.